All right, thanks, Jim. So I'm Todd Anderson, and I've been doing this work on Pepfar at GAO for a number of years. We wanted to start off with these two reports that we did under our mandated work a couple of years ago, because there were some themes that overlapped with, some themes in the IOM report. So just want to give a brief summary there. Brian Hackney, who's sitting here to my left, to your right, my partner in crime, actually, and doing this work as well. And so he's here to be able to answer any questions that you might have about the work that we did. Can everyone hear me okay?
No.
No? Okay, let me lean in. Great. So you see we've grouped these two reports here together, the first one being on performance planning and reporting, and the second one there in bold having to do with evaluations, Pepfar evaluations. So we'll talk about both of them together here. Should we come a little closer? There we go, so let's stretch. Great. So we'll talk about performance reporting for Pepfar first. Basically what we did here is there's a number of documents that that OGAC, USAID, and CDC put out annually on their performance. And so we love documents at GAO. We delved into each one of them and then looked at sort of what are some of the elements and how well they adhere to things that are called for in the Leadership Act, for example, and other parts of legislation, and then also some GAO work and sort of leading practices on performance reporting. So the key things here, the key takeaways would be that the process for generating performance plans and reports generally adheres to these standards, but there were a couple of areas where the performance plans reports, the information provided in them could be improved. And the first one here you see is, when Pepfar is discussing its results, that it compare those results against targets set for that year. So the good example would be, fiscal year 2012, Pepfar reports 5.1 million people directly supported on treatment. The target happened to be 5 million, so providing that context is useful for anyone reading about Pepfar performance. So that was one of the findings we had there, and a recommendation that OGAC provide that information in its annual reports, which it provides to Congress. The second one has to do with efforts to validate and verify the information provided, and this really gets into a GAO best practice. So, we identified a number of efforts that Pepfar agencies are involved in, both at the headquarters level and the country team level, to validate the information they're providing. However, there wasn't any information on that in the annual report or other performance reporting documents we looked at. So the recommendation there is pretty straightforward, as well as just to provide that information, so there's that extra context for someone reading those reports. Okay, then like I said, we grouped performance planning together with evaluation, and we'll jump right into evaluation. This was actually quite a big effort on the part of GAO, looking at sort of the evaluation function and what's going on out there. So to be able to kind of get a sense for that, we worked very closely with OGAC, with CDC headquarters, and with USAID. First, just to collect evaluations. And it was a big data call to the country teams, for example. CDC headquarters, USAID headquarters, and OGAC itself provided some of these evaluations. Through that process, we collected about 500 evaluations for this review. And those were evaluations of programs that were active from 08 to 10. So we would get, we had a range of maturity of programs. Those evaluations that we collected, we went through each one of them. We sort of said which program areas did they address, and we found that they addressed all of the 3, prevention, treatment, care areas, but as well as the 18 sub areas. So it was really across the board with evaluations. And then we also categorized them by evaluation type and found that they, again, were the full spectrum of types of evaluations here. So outcome evaluations, process evaluations, impact, and so on. And it's not bulleted here. Actually, I'm not quite there. It's not bulleted here, but that we also looked at the methods that were used, and there were some that were more qualitative in nature, some that were more quantitative, and then some that used mixed methods. So then once we had collected all those evaluations, then we had to figure out a way to assess them. And this is where, as Jim said, we worked really closely with our methodologists who are in-house and really are the experts on evaluation methodology and how we do this. And since we're evaluating or assessing evaluations, we want to be sure that we were as rigorous as possible in how we did this. So our colleagues helped us develop essentially a tool that we could use and systematically use to evaluate the evaluations we had collected. The tool was developed based on USAID, CDC, and OGAC guidance on evaluation, as well as GAO guidance, and we put together a list of essentially kind of elements that we could rate the evaluations on. And they had included things like whether there was appropriate design for the evaluation, whether the evaluation had some sort of criteria used to assess performance, sampling issues, and ultimately whether the design was appropriate for the types of evaluation questions that were asked. So we had subsets of evaluations that we had received. OGAC provided a number of public health evaluations that it manages. CDC and USDA headquarters provided some evaluations. And then we had the huge population of evaluations that we collected from the field. And so when we ran all of those through this sort of systematic assessment process, we found that there were some differences. The OGAC PHEs largely adhered to some of the standards that one would expect to see. The CDC and USAID headquarters ones, similar, generally adhered to those standards. Where we saw more variation and maybe some room for improvement then is the evaluations that we collected from the country teams. So you see, it's maybe hard to see on the slide here, but essentially, ultimately we were interested in knowing whether the findings of the evaluation were fully supported by the document, by the elements that were documented in the evaluation report. And for 41% of those, we did find that that was the case. However, for 59%, they were partially or not supported at all. And so that's where we, again, saw that there was perhaps some room for improving the quality of the evaluations that we had collected for this review. Another part of this review had to do with not just looking at the evaluations and what were the activities, but it had to do with what are the evaluation policies and procedures at the various agencies, so at the OGAC level and then CDC and USAID headquarters. And Brian was really involved in this part, actually. So we took the American Evaluation Association's roadmap, which lays out some general principles for evaluation, had things having to do with policies and procedures, plans, documenting evaluator independence, dissemination policies and procedures. And we basically compared the policies and procedures as they were documented to the AEA principles. And there we found some room to improve, as we often do. First one had to do with evaluation planning. We looked in the country operational plans and in the guidance that OGAC provides and didn't see a requirement for evaluation planning as part of country operational planning. So made a recommendation to that effect. We looked at whether independence of the evaluators themselves was documented in the evaluations, and we found that often that was not the case. So because one of the principles then is evaluator independence, we thought it was important to make a recommendation in that area. And the third principle there where we saw some room for improvement has to do with dissemination, and specifically online dissemination. Just the fact that we had to work with the agency headquarters to go out to the field to collect the evaluations that we did was sort of a sign that they weren't available in online. And so, in fact, when we did web searches online and some of the sources that OGAC had pointed us to, we found that there was often evaluations lacking, and so made a recommendation for OGAC to work with the agencies again on improving dissemination. So this slide here just sort of summarizes the recommendations we made in the two reports. I won't go over them in detail, but the first two there have to do with improving performance reporting and information available to the public and stakeholders on Pepfar performance. And then the last four there have just covered having to do with ways to improve the evaluation function within Pepfar. So with no further ado, we can go right to question and answer.